I'm Pat Corrales. I'm the clinic director and a physician and a lawyer. And we oversee this clinic and have the responsibility for the medical components.
Hi, I'm Ed Olson. I'm a geriatric psychiatrist on the faculty at the University of Miami. Also a JD, and have been working with the team here for a year and a half, helping to supervise the mental health portion of the medical exam. My personal reason is having gone to both medical school and law school to see the difference in how we're trained. The medical students and myself, I've told this story before, that when I first got to law school and I wrote my first exam and contracts, we had 5 hours and I finished in 2 hours because I wrote it as a physician and this is the answer. Lo and behold, I didn't realize we should be arguing both sides equally. And so we're really trained very differently. So physicians have a hard time understanding the way lawyers are trained and how they think. And this is a fantastic opportunity to watch them develop and learn what the other side, how they think and how they perceive and how they can adjust. And lawyers are not their enemy, and doctors are not the gods that they can work with.
I think I would echo what Dr. Olson said. Okay, primarily the fear factor and the perspective that physicians have of an adversarial relationship with lawyers, and yet we both have roots in advocacy for our patients and our clients. And so it's really teaching the skill set of working in an interdisciplinary manner to try and achieve a goal for the patient, to take care of their health needs, and certainly to address the legal social issues that impact on those health needs. And so for that was the perspective, and that really was the reason kind of I went to law school as well, was to understand better. I chaired an ethics committee for a long time, and it really did not have an interdisciplinary approach. And we're trying to teach young physicians and medical students their role with their true colleagues for patient care, and that's really what this is all about. From the perspective of the medical students, medical residents, they think that the law gives them one answer, and that's really their training. Their training is to get an evaluation, develop a diagnostic plan, and get the one answer for their patient's problem. And I think from that perspective, they are now learning that the law necessarily has the best answer that it can come up with, but it may not be a simple written down legal, you look at this book and it tells you what to do. And that's very hard for them to understand. And the flip side, the law students think that medicine is one answer, if you will, and they see the complexity, I think, of how we make conclusions, and they don't understand probabilities of things and how we make one answer, if you will, out of what looks like a lot of different variables that we somehow pulled something out of the air. So I think the two sides are beginning to understand each other's decisional processes, and that helps them take care of their clients and their patients. The other thing we do is we do kind of a joint lecture series with the medical residents and the law students, and each side practices their skills, and we have the law students doing depositions on the medical residents and the medical residents testifying, if you will. And we use them as not kind of adversarial, it's really them being a medical expert witness. And yet they have reported afterwards that the experience has been wonderful because even though they weren't being challenged, they had a very high blood pressure and pulse rate in just the setting where they were being asked questions by a lawyer. So we're trying to demystify the common areas where physicians testify or have to do depositions, or and we talked about the medical record as evidence and how we truly just document what we find. And it's very important to have that perspective and skill set. And the law students, I think, have the skill set as well, because Jonelle and Melissa sit there and coach them, and we're on the other side to help them know how to respond to the questions in a manner that is helpful.
We had a case of a patient who wanted to go home. His son was abusive to him. He had a mental status exam done by an inpatient consult psychiatrist and was declared demented. So social work then decided that he should go to a nursing home. He did not want to go to the nursing home. He was presented in our here, and we realized that looking at his history, having the geriatric psychiatrist, the forensic psychiatrist, and the internist, that this man probably came in with a delirium, and that in all cases, or most likely, that delirium had cleared by now, and he was no longer incompetent to make his own decisions. So through this clinic, we were able to go back, reevaluate him, and sure enough, he was very competent to make his own decisions. And then the legal side worked to get a restraining order for the son to not be able to go in and beat his dad up. And everybody learned something from that. Social worker learned more about deliriums and dementias and the differences. The resident learned about how an abusive son can keep a dad demented and cause lots of problems. And the geri-psychiatrist again got reinforced that, when a patient comes in, they could be delirious and the mental status doesn't say the same all the time.